Hi everyone, my name is Dr. Kimberly Evans. I'm from Sugar Land Medical Spa and I'm going to actually demonstrate the EmFemme for you. This is one of my favorite newest devices. It's helping a lot of women regain their confidence, feel awesome. It helps with incontinence. It also helps with sexual function. So I just want to show you how cool the screen is. If you take here a look at the screen here, it's touch screen. It's absolutely beautiful. We've already entered, we started the process getting to the screen. We're going to be at 65% for radio frequency. Our time is going to be 8 minutes for therapy. And we're going to enter our patient information here, who has so graciously allowed us to take care of her today. Okay. So the cool thing about this device, there's several cool things about it. Not only just the nice, sexy design, but in addition, it's very customized for every patient. Have a glove, please. Thank you. It's very customized for every patient. So literally, this is one of the probes. There's a couple different sizes of the probes. We just chose this one for this particular patient. There's other things too about the handpiece in which I can actually change the radio frequency amount for her just by touching here, and you'll look at the screen and you can see it go up or down. Oh, let me touch it again. I'm sorry, I didn't touch it the right way. See? It's actually all on the handpiece. Great. We have our minutes set for treatment, and then we can always adjust that too. The design is very comfortable. It has a circumferential tip. This is what emits the radio frequency energy. Our patient already has her grounding pad on for safety, and then as you'll see as I do the treatment, you'll actually see these change. There's also an outside tip too, which I'll show you here shortly. We haven't quite opened the package yet, but I'll show you what it looks like. The outside tip is for the vulva. You can treat the perineum, both sides of the vulva. You can actually treat the mons too. And again, they're very, very intelligent. When I change this on the device will notice that, hey, I've switched to the outer tip. Okay, perfect. All right, so we've already prepped our wonderful patient, and she's going to notify us that she's comfortable, correct?
Yes.
Okay, good. I usually tell my patients to let me know on a scale from 1 to 10 if by chance they're more uncomfortable, greater than 5 in general. Otherwise, it more or less feels like a hot stone massage. So again, it's very comfortable. We have our patient properly positioned. We use these stirrups. You can also use other stirrups too. We just like these because they do a little bit more support with the knees. Because of course, if they're going to have their feet in the air, you want them to be comfortable, you know. Okay, so I'm going to go ahead and get started here. And I have my ultrasound gel, which I'm going to use here. Again, we've already set our device and it's already prepped. I'm going to put a little bit of gel here actually on the tip to make it comfortable. Okay, and then with our patient, I'm just going to feel me touch here. A little bit of pressure, sweetie pie. Pressure, pressure, pressure. Lots and lots and lots of pressure. Okay, and then on the device, and it should just go ahead and start. Super duper easy. Okay. When we do this device, again, it's nice, smooth, steady movements. Is this too much pressure for you? Okay, awesome. You are doing wonderful. Okay. Notice too that the device, when I press a button on the device, every 30 seconds it pauses for safety. So that's one of the other cool things about it. And also too, on the device you can actually see the temperature heating up too. We're now at about 38.4 degrees, okay? Okay, now what we're going to do is we're going to be switching to the outside therapy session. So when I place the tip on the device, it automatically changes. It realizes that I'm on the external. Okay, and then we're going to do 5 minutes on the external, and then go ahead and press play for me. Awesome. Very good. So again, we've already treated I'm going to put some more gel here. We've already treated the inside. She tolerated it very well. Pain score never got above 2. So 2 out of 10. So that's absolutely fantastic. Okay, good. So I'm all set here. And this is how I do it. So again, I'm treating the outside. Most people, you could need between 5 to 10 minutes, just depending on the tissue type. Because it acts on fattier tissue, the labia is actually perfect for this. And what I'm doing is I'm just spending a few minutes on each side, and I'm actually raising the temperature. And this device, it kind of yells at you if you're going too fast or if you're not doing it right. So now it's like I just had to slow it down a little bit. And I'm just going to kind of keep going. Just nice and smooth movements. And what's your number on discomfort?
2.
Excellent. Perfect. And all you do with this is I just kind of take my time with this. There's different techniques to actually covering the tissue. As long as you cover the full tissue and you do your best to kind of get the temperature up, you should have fantastic results, okay? So also too, when I do this, our sweet patient, and this happens with a lot of ladies, we can get these little wrinkles down here, just like you can get wrinkles in the face, you get wrinkles down here. So similar to the face device, this causes a tightening of the skin. And then after you get that tightening of the skin, then what happens, you get a more youthful appearance and a tighter appearance certainly too. And that's what a lot of women love, okay? So on this side, we're reading at about 40, 41 degrees. The faster that you go, the more comfortable it'll be for the patient. But then of course, I think that it's best to kind of try to distribute the temperature as much as possible, because the perineum right there is actually one of the shortest, smallest areas. When you can look at the whole labia, I just kind of gradually increase the temperature of everything just to make it nice and comfortable, rather than totally, heating up one side and then trying to totally heat up the other side. I just found that that's a little bit more comfortable for the patients. So again, just gently heating up the tissue. Now we're at 41 degrees on this side, so before it gets too uncomfortable, kind of switch. I do a little bit on the perineum here, and then again, I just kind of switch sides. So for some of my patients, not necessarily my current one here, but I found it helpful to use also a little washcloth in this area. And what that does is it kind of stretches the tissue, as you can see. I tried to use a 4x4 before, but it seems that my washcloth actually stretches it a little bit better. And again, perineum area here. What's your number?
2.
Excellent. So notice the temperature is able to go up and our pain score is still the same. Actually, I guess that's not a pain score. That's actually a discomfort score, just to clarify. And she's doing absolutely fantastic. And again, just increasing the temperature here as much as possible. Sometimes if you get too uncomfortable, you can always put a fan here. I'll do that sometimes. I think the fan's more for me, but I found that it's just a little bit harder to get that temperature up and keep it up with a fan on. But I love it because, again, you can tell exactly what temperature the skin is at all times. That way you know that you're being safe and you're bringing it up nice and uniformly. Now we're at 42 degrees. What's your discomfort score? 1 to 10 is 10 being the worst. Good, we're still at 2. You're doing absolutely beautiful. I'm going to put some more gel on here in just a moment. make it more comfortable, and it can just glide a little bit easier. So again, we're at 41 degrees here. And again, goal is just to cover the whole area. And again, very, very smooth movements. That's really the key with all this stuff. Excellent, excellent. Very good. Okay. So we'll take a look over here. And I'm going to get her cleaned up here in just a moment. And we've stopped the device. Perfect. And then we're just going to remove the tip. Very good. So when we look here, again, I'm just going to get her all wiped off here. Can I have some baby wipes too? Thank you. Perfect. So the baby wipes are nice and soft, and they kind of get at the tissues in between. So I would recommend, if you're going to have your device, this is the best way to do it here. Perfect. And then as you can see, you have a nice pinkish tissue here, which shows you that you have like a good result. Comfortable still?
Yes.
Excellent. Good. So this is perfect treatment. She did fantastic. And I thank you so much for watching. Take care.